Hello, everybody. I'm going to talk a little slowly while people kind of log on. My name is Russell Spieth. I'm a psychologist and representing the Ohio Program for Campus Safety and Mental Health. Jessica, you want to introduce yourself?
Absolutely. So my name is Jessica Zavala, and I'm the manager for the Ohio Program for Campus Safety and Mental Health.
Nice. So we will get out of your way here in a moment. We know, as always, you did not log on to hear us introduce ourselves or give announcements, but we want to get through a few things. There will not be a webinar for the month of December. We're all going to take a break then, but we do invite you to join us on January 16th. We'll be sending out an email about this, but January 16th is we're going to resume with representatives from the Center of Psychiatric Rehabilitation out of Boston University. They're going to give us an overview of their peer academic supports for success program, which they call PASS, and how peer academic coaching can be designed to meet the supportive needs of college students with mental health conditions. So as always, be on the lookout for a registration link for that.
All right. Thank you, Russell, for those brief announcements. So without further ado, I do have the pleasure to introduce our presenter for today, Jessica Stevens. She's from the Mental Health and Recovery Services Board of Wayne and Holmes County. Jessica completed her bachelor's in social work program at the University of Akron in 2015, and then in 2016, she completed her master's in social work. She was nominated for and awarded the NASW Ohio Chapter Region 8 MSW Student of the Year in 2016. Internships during her bachelor's and master's afforded her the opportunity to gain experience with equine therapy and medical social work, in which she performed at Union Hospital. During her master's, she served as a graduate assistant and assisted with planning, lecture development, presentation, as well as some other opportunities working with bachelor level students. Following the completion of her degree, she worked as a medical social worker at Wooster Community Hospital. And within the healthcare system, she was able to work alongside individuals experiencing mental health, chemical dependency, homelessness, crises, trauma and loss, as well as other psychosocial needs that serve as barriers to accessing appropriate resources. Jessica now serves as the program coordinator of the Mental Health and Recovery Board of Wayne and Holmes Counties. And additionally, she served as an adjunct professor for the undergraduate social work program at the University of Akron and Wayne College. So once again, without further ado, we'll have Jessica Stevens to go ahead and kick it off for us.
Great. Thank you, Jessica, for that introduction. Hello, everyone. Thank you for letting me take up some of your afternoon. I think Jessica kind of went over most of my background. So just to go a little more into that, I was born and raised here in Wayne County, which is very rural. So I currently work at the Mental Health and Recovery Board, and for the past couple years, we've been able to get this grant through Neomed to provide QPR at our local campuses. So in Wayne County, our population is approximately 116,000, and then we also serve Holmes County as well, and the population is approximately 50,000 there. So very small rural communities. Being that they are small, though, we still have 3 college campuses within our counties. So the University of Akron has a small branch here, which is Wayne College. We also have the College of Wooster, and then Ohio State University has their Agricultural Technical Institute. So we do only implement the QPR in the College of Wooster and University of Akron campus because the Ohio State University has their own evidence-based suicide prevention. So we collaborate with them in other ways, but College of Wooster and University of Akron are who we primarily incorporate the QPR with. And to kind of go into the communities even within those colleges. So the College of Wooster has approximately 2,000 students. Of those, a little over a fifth of the population identifies as students of color, 16% are international students, and 72% of them are non-Ohio students. So this certainly puts them at an increased risk for isolation from primary supports. Many of them, their closest family member is Georgia, California, and some are even across seas. So they're not seeing them for up to 9 or 10 months throughout their school year. And then on top of that, they're being put into a very, very, very rural community that can be very much a culture shock. And then our University of Akron Wayne College has approximately 2,600 students, also largely rural. And within the rural community, we don't have a ton of exposure to mental health education and awareness or the resources available growing up. A lot of times, conversations before we go to college is this is going to be, the best time of your life. And sometimes, we want to start changing that conversation for students, because when they get here and things aren't going as greatly as expected, they sometimes think that something's wrong with them. They don't know who to reach out to because no one else is experiencing this. So we really want to try and start changing that conversation and how we have that with students. So why we picked this population, within our small rural community, we do have a lot of college campuses here, which means we have a lot of college students. All three of those campuses are just within Wayne County. Currently, we don't have any of the college campuses in Holmes County. So that's why this is primarily focused in the Wayne area. With that being said, we know that the ages of 15 to 24 are high risk for onset of mental health symptoms. So certainly a very important population, and one that we're seeing an influx because of our college campuses, and we want to focus on. So some of these identified risk factors in student populations are the isolation component, limited access to primary supports, minimal awareness of community resources, stigma, and then potentially unrealistic expectations. So the isolation and limited access we see to the primary supports primarily are students that are living on campus. So they're living away from family. And again, when we're talking about our College of Wooster population, a lot of those students are coming internationally and are having very minimal contact with their family compared to, your average student that maybe is going 45 minutes from home. So we just see a very increased risk with those students. Minimal awareness of community resources. I don't think that many of us, when we went to college, were made aware of what resources were available for mental health outside of what's on campus. So we're really trying to raise that awareness as well for students that maybe don't want to seek that help on campus, or if they need, greater help. And then, of course, the stigma. I think most of us that are aware of the crisis we were having in Ohio with the agricultural community, we're seeing that here in our counties as well, because we are a very large agricultural-based community. We've seen that stigma and people not reaching out for resources, and those people that want to help individuals in that agricultural realm maybe not being aware of what resources to provide them with either, if those risks are coming to their attention. So QPR stands for Question, Persuade, and Refer. It was developed by Dr. Paul Quinnett and first discussed in 1995. It's an evidence-based practice, which is an emergency mental health intervention. So the intent would be to detect suicidal risk and be able to assist and avoid that becoming a mental health crisis. And really making sure that we prepare the people that are trained as gatekeepers to be aware of what resources are available to people they want to help, and making them feel prepared to help. We've gotten feedback from students in the past that the training has been extremely helpful in that regard, that they feel, compared to maybe past situations with peers, that they now feel prepared to have that conversation, to direct other students, and play a key role in helping them get assistance. So as far as the gatekeeper, the purpose of that is, one, to recognize the warning signs of suicide, make people aware of the risks outside of just, I'm thinking of hurting myself, whether that's disinterest in normal activities, poor appetite, increased sleep behaviors, and being aware of those so that we can start that conversation, because without the knowledge to be aware of what those signs are, we wouldn't necessarily know to start that conversation. The second component of being the gatekeeper is to know how to offer hope. So how to be supportive. A lot of feedback we've gotten from people through this training is, well, I just don't know what to say. So really just kind of being a supportive role, and there isn't any magic phrase to say. It's just being supportive, being there, listening, And then 3 is for them to have the knowledge of how to get help and how to save a life. So knowing what resources are available, knowing what our next steps should be, and particularly with our college students, is knowing who to reach out to next, whether they feel comfortable reaching out to a local or mobile crisis team, or whether it's just pointing them in the direction of a staff member or faculty member that they need to be in touch with as a point person. And then again, QPR, really their goal is to be as widely known and aware of as CPR. So CPR, we all know, is an emergency medical intervention, and QPR really is working to be that emergency mental health intervention that we're widely spreading across our populations for awareness. So guiding principles, again, it's an evidence-based practice. So it's recognized by the American Foundation of Suicide Prevention, the Ohio Suicide Prevention Foundation. This whole process is very supported by our local Suicide Prevention Coalition. We report out on it every month. They're always curious how it's going, how they can help as well. So we're really excited to see that partnership and that support throughout our community for it. And again, this kind of goes back to that gatekeeper role where, one, we really want to focus on giving them the awareness so that they know what these signs of suicide are. They know what to kind of keep an eye out for and be aware of when they're having conversations with their peer, when they're interacting with them. The surveillance of that. So just constantly being aware of what is going on around me, how can I help other people, and then the detection is kind of knowing, once I've had that conversation, how severe is this and where do we need to go resource-wise from here. And again, this as an early intervention, we know with many mental health and addiction treatments, the earlier recognition we have, the better outcomes we have. So we really just want to be pushing that forward, and we know that students, being part of that peer population, are going to interact potentially more with their other peers than maybe our faculty or staff would be. They're going to be with them more frequently in the dorms as well. So 5 decisions that we want our gatekeepers to be comfortable making and knowing what to make before they engage in active assistance. They need to notice the situation. So again, going back to the signs of suicide, you have to be aware of what's happening, what's going on. Without awareness, we're not going to approach them. And then interpret the situation as an emergency. So recognizing the severity of it. Once I recognize this behavior, I need to associate it with the fact that this could be a risk for suicide. Deciding to take personal responsibility. So recognizing at this point, I've acknowledged this as an emergency, and now I need to take action in helping this person, whether it's having this conversation and letting them know what resources they can reach out to, or having this conversation and recognizing this is very severe and we need to get immediate assistance. Deciding how to help, and then decide to implement the decision. So once we've maybe had this conversation of, it sounds like you're having a difficult time, here are some counseling resources, or I'm happy to walk with you to the counselor, or this is really severe and we need to have someone evaluate now. And then actually implementing that decision, having the courage to do that. And gatekeepers are most effective when they recognize the suicidal warning signs and feel confident in how to accurately question and intervene. So again, with this population, we certainly want to engage our faculty and staff, for longevity. Once they're trained, they're often there. With students, our main purpose is that they are around their peers. They're going to better be able to have those conversations. They're going to be having them more frequently. And the biggest thing we want to do is empower them to have those conversations and have them securely and soundly and comfortably, and make sure that they feel they have the resources to help someone, and they're not going to start a conversation and not know how to help their peer or be completely overwhelmed. And we've gotten a lot of good feedback from our students that has been very helpful. So another component is the OODA Loop. So to effectively implement QPR intervention, all components of the OODA Loop must be satisfied. So both the O's, the first O is observation. I feel like we've kind of drove this home, but observation of the suicidal warning signs. The second O is orientation and situational awareness that something bad could happen. So once we've recognized these suicidal warning signs, what could they be leaning towards? The D is decisional capacity to know what needs to be done. So again, being aware of what resources are appropriate for the conversation I'm having with this individual, and then action. So actually taking action once we've identified that there's risk of suicide, and we want an intervention for that. So again, on campus, how we pretty much have it formatted is we usually have a minimum of 1 to 2 trainers on each campus. We want one of those to be staff or faculty. Again, like I said, the purpose of that is they're building relationships. Oftentimes our staff and faculty will have a relationship with students for the duration of their time there, which is positive. And then the longevity of it, once they've gone through that training, they're there. We also like to have students trained for the point made previously that they're around their peers more. They're going to see them on campus housing, in classes, at lunch. They're not isolated to just that class setting. The only issue you can run into that with is students don't necessarily have the longevity of staff and faculty, of course, but I think regardless, even if they leave that campus, even if they've gotten that training has been paid for, that's a skill that they have going forward, and that is kind of invaluable. But again, on each campus, we have at least 1 to 2. Akron in the past has had, or Wayne campus has in the past had 3. At the College of Wooster, they focus on training their RAs. So again, the youth that are over their peers in residential halls, and they do kind of serve as a gatekeeper in a lot of ways, making sure everyone's following the rules. So I think that your students that are RAs are a very good point person for a lot of your other students as they start to engage on campus. So that is a training that the College of Wooster does every year, typically in the fall, and then in the spring again if they need, and they'll always do one with their staff. And at the University of Akron Wayne campus, they do not have residential housing. So all of those students do commute or live locally. So they typically try to target their freshman classes, general education, and any introduction courses. And on each campus, we have approximately 80 to 120 students, faculty, and staff that are trained in QPR each year. So the next slide is just kind of going over what those numbers look like for us. So last year, I know our report for the University of Akron Wayne College campus, we had 145 people trained total. And that was 118 students, 10 faculty, 17 staff. And for the College of Wooster, we had 85 students and 17 staff, totaling 102 individuals. So that is how our program primarily works. We look forward to continuing it. We do have QPR throughout our community as well as within the college campus. And we have used trainers that we have in the community that haven't been paid for the grant to come and help on college campus if we have larger groups. So again, we have a lot of community support, which is very helpful in implementing this. And we're very grateful for the opportunity we get from the NeoMed grant. And I think I will go ahead and open it up for questions if anyone has them.
Nice, Jessica. Thank you so much for that. Appreciate that. So we have a few questions. So one is you discussed the diversity of the student population that you're trying to reach.
Yes.
International students, racial minority students, commuter students, things like that.
Mm-hmm.
What have you found helpful in terms of ensuring that the QPR is being spread wide across those student groups and that students have the ability to kind of shape the marketing and the messaging around QPR?
Yeah, so again, the College of Wooster campus is where we primarily see a lot of international students not from our state. So we really try and focus on that RA population because all of those students are going to be living at residential housing on campus. We feel that's the best way to target them. They make it a requirement for the RAs to come, but they do open it to all other students, and it's usually held in a residential hall on campus, so it's easy for them to get to. So that's how we try and tailor it to that group. And I don't want to take credit for that. That has been, the College of Wooster, making sure to reach that population. And on the Wayne campus, what we try and do is, because not all students are traditional on that campus, we try to make sure that we're hitting those introduction courses, any freshman courses, and any gen ed courses. Outside of that, we certainly open it. We do let professors know that they can open that to other students if they have availability that day. But at this time, we don't have enough trainers. We can hit every single class, but that's how we try and address that.
Okay, nice. Thank you. And another question is, in terms of, I saw that you have some faculty participation. How are you able to get kind of any buy-in from faculty to carve out time to attend these trainings?
So they usually do it as part of, like an in-service day. If they have other trainings, they'll do them that way. And most of the faculty are very open to allowing our QPR trainers to come into their classes, and they'll stay for that. Or we've even had where professors are, if they teach like a very similar course in the same school, they'll kind of swap a class if one's already been through the training so they can sit through it and have the other one cover. But we don't have too much trouble getting the faculty buy-in. They're usually very open to it. They want, the experience and understanding as well, so that they feel comfortable if a student comes forward with that. So we haven't, we've seen very much success with that.
Okay. So it sounds like one way of doing it though is that if there's a course that it fits in like one of those introductory courses like you mentioned, that might be a good opportunity to invite that faculty member to stay through the presentation, so they'd be getting
Absolutely.
it.
Yeah.
Okay. So another question is, how do you, when you're kind of vetting people to train at a particular organization, and you mentioned 1 to 2 people, how do you determine like who would be a good employee and who would be a good student to participate in the training, so they could be the trainer?
Yeah, so we obviously have a contact at each university. So for the College of Wooster, we have Steve Glick, who is over their security, and at the University of Akron, we have Dr. Jane Fink, who is over their counseling department. And so Jane has been a trainer, and she has pretty much vetted the other faculty or students that she believes would be good for that. And then Steve is not currently a trainer, but he usually has someone within his department that he vets. So usually someone that's passionate about it, someone that's going to care about it, and feels, it's usually been a staff member that has come forward actually and asked, this is a situation I've had and I feel like maybe I could have handled it better. And they kind of become the champion for it then at that organization.
So the idea is that really you'd want to target people probably across the board who have an invested interest in it.
Yeah, absolutely. And the more people we can get, the better. We certainly don't want to isolate it to one school within the university or anything like that. So certainly just doing outreach, and then as long as they express an interest and want to go forth with it, we're supportive of that and want to help them do that.
And what about on the student side? Because as you well know, QPR can be, like emotionally challenging, not only for the presenter, but for the participants. And, it's not uncommon for the participants in the audience to have had their own stories around suicide and kind of need to process that with somebody. So on the student side, sort of how do you vet students and how do you prepare them for, I know that the training does that as well, but, how do you kind of, find the right students and support them?
Yeah, absolutely. So historically, the students that have been trained are usually psychology majors, social work majors. I believe there's been education majors as well. And I believe they meet with our points of contact at each university. So Dr. Fink and Steve Glick, just make sure everything's going well. We make sure that they know they have support and where that support is on campus if they need it as well. And certainly address the fact that if you come to a conversation with a peer regarding suicide, that can certainly be traumatic and overwhelming, and making sure that they're supported through that process as well. Not only are they supporting their peers, but making sure that we're kind of engulfing them in that support to help them navigate it as well.
Okay. Thank you. And there's a question about how do you teach hold on a second, sorry. Yeah, how do you teach the common indicators of mental health, particularly suicide? What are some of the things that you have your trainees look for?
Often we look for some of the ones that have been mentioned, change in appetite, change in sleep behaviors, disinterest, more irritability, like kind of disinterest in their classes, being late to class, not paying attention, some of the things that we think they're going to see more in that setting, of course.
And it seems a distinction that's good for people to know is that QPR does focus on mental health sort of generally, but it's really sort of looking at distress cues that may lead someone to think that someone's in a crisis, right? Where, and it's meant to be a bit briefer and a little bit more specific to suicide risk factors, as opposed to things like mental health first aid, which is sort of more comprehensive and longer, and people learn a little bit more about symptoms that are congruent with bipolar disorder and major depressive disorder and anxiety disorder.
Right.
So kind of, I guess, interesting your thoughts about that, but it kind of depends on what your goal is as a campus, right?
Right.
In terms of what type of sort of gatekeeper / mental health awareness campaign you would use. What are your thoughts about that? Sort of how to think about QPR versus mental health first aid versus some of the other models out there?
Yeah, QPR we think is really good for the campus setting because it is, a shorter training time, and it is to start building that awareness. We certainly don't expect, all of our college students to know every type of symptom for every mental health diagnosis, but we want them to be aware of what are some of these signs that they might pick up on that we can start gearing people towards resources before it does become a crisis. And then certainly to know what are the signs when someone is in a crisis so we know how to take care of it. But as much prevention as we can do is certainly a goal as well.
And Jessica, there's another question here. Are there ways you suggest to help calm the students and to calm their stress?
That's a very good question. I think just making sure to provide them with support, knowing what support they have, and always kind of having an open door approach. If you have some of those champions within your university, whether they're QPR trainers or not, and letting students know who they can reach out to. I know we have some great faculty on both campuses that have been made available, and there are certainly efforts on each campus where they do like health fairs and they'll bring in therapy dogs, but those only kind of hit at one point in the year. And I think just having a constant awareness of that as faculty and staff, and how to support your students best.
And I actually have another follow-up question. You mentioned in your presentation regarding the crisis within the agricultural community. And I was curious if you could expand on that a little bit and maybe how that's impacted students. Maybe some of those issues or challenges or whatnot that they face in terms of being from the agriculture or from a more rural community.
Yeah, so this year there was kind of a crisis within the agricultural world. Just financially, crop-wise, things weren't going well. A lot of people were losing farms, losing income that they're used to having, and we were seeing a spike in mental health exacerbating systems as well as suicide. And as a state, the Ohio Department of Mental Health Addiction Services and the Ohio Department of Agricultural Services kind of got together to start, working together on how to do that. I know they launched a campaign called Got Your Back that was initiated out of Tuscarawas County, and really just trying to raise that awareness of mental health and trying to wrap that community in resources. And as I said, I grew up here, that those weren't conversations we had. I have a ton of friends that grew up on farms, and they weren't conversations our parents ever had with us. And so that community is definitely kind of isolated from those resources. It's not a conversation we're constantly having. So we've been trying to gear that up. And I think I briefly mentioned, OSU, our agricultural institute locally, doesn't do QPR because they do REACH, which is an evidence-based program through OSU. But what we've been working with them this calendar year is starting to kind of do a needs assessment around the mental health awareness that those students have, and how can we better address that with them, because we do know that's a high population, and we want to make sure that we're addressing those needs and how they've been affected in the last year.
So to that point, I guess, even if we're not from an agricultural community, communities at any given time face different stressors, right? And it's kind of like the ecosystem surrounding the students and their families and the university. So what have you found helpful from your perspective in terms of what you're referring to with the agricultural community? Is it, are you all doing things like for orientation, kind of naming it, right? That you're aware that these issues have been potentially affecting the community? I guess I'm kind of wondering, you sort of proactive around it, like kind of naming it, and that therefore that could be a source of stress for students potentially, or is it more kind of waiting to see if it bubbles up and then speaking to it?
Yeah, I would say we're more waiting to see how it bubbles up. We're not necessarily going into trainings and saying we know this is a crisis. Again, I think we're focused a little more on it on that ATI component where they don't do the QPR, because we know all those students are primarily getting agriculturally based degrees and hoping to go into that field. We certainly recognize that there are students at the other campuses that are likely part of that population, but we're not necessarily coming out and just saying we know this has been an issue. We certainly try and cater to that, I think, as universities and staff, and being aware of what some of those are, but we're not necessarily coming out and naming that we know that this is an issue.
Gotcha. And then in the needs assessment that you're referring to with the OSU Agricultural School, what is your strategy to do that, and what is the purpose? What are you hoping to find out?
So we're still kind of developing that. We're hoping to get that rolled out on campus within the next month and a half. But the goal is really to kind of identify where is the student's awareness of mental health. Like, are they aware of some of the symptoms associated? Are they aware of what resources are available on campus, off of campus? And trying to get an idea of what they feel they maybe need for more supports. And then hopefully, we would use that to engage some students to start implementing what we find, whether it's programming on campus, if they can do that, or linking them, getting more involvement from our community agencies on their campus to be helpful, and just trying to kind of figure out what needs are surrounding them and how can we better help.
Gotcha. Thank you.
And I actually have a question, Jessica. I don't know if you're going to follow up to the needs assessment. It's actually separate.
No, I was going to do something else.
Okay.
Yeah.
So my question is regarding international students, and I'm just curious whether or not you've been successful, because I know you mentioned it. Sometimes it's better to have students to obviously become trainers because they also connect well to other students. But I'm just curious if you had any success with perhaps international students wanting to become QPR trainers.
To my knowledge, I don't believe that we do have any international students that have become QPR trainers. I know some of them have been trained, because I know that we've successfully had some RAs, get students the help that they need. I don't believe that they themselves are the QPR trainers on campus, but they've been trained in it.
Thank you.
Great, thank you. And this could be kind of a couple of part questions. We have one about how do you help students recognize the resources available for mental health without upsetting them? So kind of the idea is, bringing up it's kind of like that, the question, the persuade, the referral part of QPR, when you're trying to be collaborative and empowering and compassionate, without being upsetting to somebody, especially if it's a community where mental health isn't typically even discussed. So what kind of, I know, what would kind of be some approaches to having that conversation with students?
I think one of the biggest successes we've actually seen with the students is when that peer offers to go with them. And oftentimes that's not to maybe an appointment off campus, but if it's to just initially see the counselor that's on staff, there's been a lot of success with that, either I'll go with you or I'll sit here and do this call with you. And just kind of being that support person in that moment really seems to be helpful in initiating the services.
Nice. So it's not like just kind of like dumping your thoughts on somebody and leaving.
Yeah, it's not like we just hand you a list and good luck calling. It's really kind of holding their hand through it and, how can I be supportive to you through this, because I know it's hard. And we've been very fortunate to have students, willing to do that and taking that approach, but we've seen some success with that. So, yes.
I know part of it too is sort of to some degree, and it's normalizing is not quite the right way of putting it, but to some degree it is sort of normalizing that stress and distress and even sometimes thoughts of suicide are experiences that are not, completely uncommon when you're going through college, because it's a stressful environment. And I think in some way, therefore, helping the person that you're discussing with see that can be a rational response to a really stressful situation, right?
Yeah, I think making sure that they don't feel completely isolated, or that, they're the only person that's ever felt this way, and knowing that some of their peers are struggling with the same things.
Yeah, definitely. And we found to some degree helpful at NeoMed to use data that we have about students in terms of thoughts about suicide and depressive symptoms and anxiety symptoms as a part of those discussions, so that people can see kind of the data around what's happening with their peers to be helpful. I'm wondering on kind of a two-point question, which gets to the referral part. At least in a lot of communities, not only are the counseling centers on a wait list, right, and not for someone who's in an imminent risk, right, of hurting themselves. That would be, those folks can typically be seen. But where it's someone who's significantly distressed and would benefit from counseling, but they're going to be on a wait list. But then not only internally, but then externally, the resources outside of the campus oftentimes have a wait list. So I have the first question is, how do you kind of, first of all, is that an issue in the communities that you're serving? And if so, how do you kind of deal with that?
Well, I'm very fortunate I work at the board because I do know this. So a lot of our agencies within the community that we contract with don't have a waiting list. So we contract with 5 agencies, and they block out usually about a 2-hour period at some point in their day, mostly it's in the morning, that they can just do kind of walk-in appointments. And so especially when there's someone that we know has kind of maybe had a rough evening and maybe isn't totally in crisis and needs that mobile crisis team to evaluate them, but we're approaching that crisis, they're really good about getting them in. So we typically don't have any issue getting clients to be seen within the next 12 hours or so. And some of those agencies even have kind of a referral form where it's just, which not that necessarily our students have access to, but some of like your counseling staff would, where they can just send, like if it's a late night conversation that you have, you can just fax that in with the time, and then that appointment's made as soon as someone comes in that next morning.
So that's pretty awesome.
Yeah.
I'm wondering, so it sounds like college students could potentially go to one of 5, right, kind of organizations. Have you found it helpful to have the representatives from the university as well as representatives from the particular mental health organizations to get together periodically to discuss sort of the way in which they can help one another and collaborate and that sort of thing? Or how does that kind of work?
Yeah, so we don't necessarily have a meeting, so to speak, where we bring those organizations and our mental health agencies together. There's meetings that many of them are at, and they discuss, but I think because our community is so small, there's a lot of those informal relationships. And I know, many of our executive directors at these agencies have relationships with like Dr. Jane Fink and Steve Glick, who've both been prominent members in our community for a long time. So those relationships are they're very informal, but they're certainly occurring. And I think that's very, very helpful. I think it gives the staff on campus kind of an edge to refer people appropriately if they don't want the service on campus. And I think likewise, if you have someone within the community that's being seen and maybe they know they're transitioning to campus, there's kind of that nice handoff to someone that they trust on either end.
Right. So it sounds like what you're saying is that fortunately in your community, it just kind of happens naturally because it's a small community, so folks know one another and sort of know what one another's about and how to be good partners. Though for communities where they have a different setup, it may be helpful to have more kind of formal collaborative processes so that people can discuss who's an appropriate referral, what would a student expect, that type of thing. Is that correct?
Yeah, absolutely. I think that would certainly be valuable. And even just, an idea for some communities. I know ours has recently done with our elementaries because we have about, I think, 9 within Wayne County, or not just elementaries, but school systems. We actually made a matrix of different like mental health and substance abuse item topics, and then listed what agencies within our community can provide what service that falls within that, so that our elementary, middle schools, and high schools kind of have an idea if they do need this service, maybe who they can reach out to. So we've seen a lot of success with that as well.
That's a great idea. You were kind of mentioning, I would call it data no matter what, but you were mentioning that you sort of got feedback from students, in particular that, oh wow, I found this really helpful because of XYZ. I'm kind of wondering if you all are collecting kind of more formal data around what was the impact of these trainings. And yeah, I guess that's the first question. Are you, like surveys or something like that? Or how are you kind of collecting what the impact has been from these trainings?
So we haven't done the surveys. I think that would certainly be valuable in the future. It's more just been word of mouth. So maybe after that conversation has happened on campus, one of those students that was trained by a trainer on campus who is typically a faculty member, they'll go share that with them, and then that kind of gets reported back to us is how we've been getting it. But I think the survey is almost invaluable. I think it would be good to do after the training, and then maybe even at the end of the year, just for anyone that potentially was able to use it and how was it beneficial.
Mm-hmm. What do you wish that you would have known prior to starting to implement QPR across college campuses that you learned later on?
I think initially, I believe we just did the faculty and staff. So I think moving forward, or looking back, it would have been helpful to get students brought in a little sooner. I think sometimes though, your students are a little more reluctant because maybe they don't feel confident in being a trainer. But I think just really trying to engage your students as much as you can as kind of leaders and champions of that project is so beneficial. And I think that's a really good place to start. And even, incorporating them on your team when you're having meetings about it and how to implement it. Because I think that they have very valuable insights, and it's a really good way to get them involved.
Mm-hmm. So even beyond what you're saying is even beyond students being formal presenters and going through the train the trainer process, mm-hmm. even having students just be a part of kind of like your work group to determine how you're going to implement QPR is helpful.
Yeah, absolutely.
What things did you learn from students in that process? Not the train the trainer part, but in terms of sort of implementing QPR.
I think just to, oftentimes they like an opportunity. I mean, I don't want to say like, because none of us really like role playing, right? But giving them an opportunity to kind of engage in a safe setting where they know, okay, this isn't real, but kind of giving them that brief practice, and then it kind of gives them, a peer that they know they can talk to if they ever do kind of bump into that, like, oh, do you have a suggestion for how to maybe handle this next time? So really just trying to get them to engage, have that opportunity to do it in a safe environment. And then also, let them know who around them has been trained. So if they do have questions moving forward, that they have kind of that support system also.
I actually have a question because you mentioned that one of it was the College of Wooster campus, or it might have been the University of Akron, but that there were sustainability and or longevity issues. And so how have you handled that when, let's say you've had a trainer that's come through, a student trainer, and now they're moving on? What are some of the approaches that you've taken to engage other students to become trainers? Or
so I know oftentimes it's been kind of a discussion with that student of, do you know any underclassmen that you think would be interested, and almost allowing them to serve as like a vet for someone if they would become interested. And then certainly just kind of doing outreach in those classes that we've done in the past, making students aware like this is something you could train for. So that's how we've kind of dealt with it in the past. But
great, thank you.
Any other suggestions or any kind of, for our listeners, anything else you can think of that would be helpful as they think about whether or not they would want to take on QPR versus not taking on QPR, or even another type of a model?
I don't think necessarily. I think what we've found very helpful with QPR is the duration of it. It's an hour training versus mental health first aid, which is 8 hours. So it's certainly a lot more feasible for people to do. There's value in both, certainly, but we've found that seems to be a good introduction for individuals that maybe haven't had much awareness to it. It's fairly easy to implement. And I would just say, if this is something you're trying to incorporate on your campus, if you have a suicide prevention coalition, maybe try and bring them to the table, see if they have ideas, see who's willing to support. I know ours has been extremely supportive in just kind of helping us brainstorm with different ideas. So, engaging your community as best you can is significantly helpful.
Mm-hmm. That's helpful. And we found the same thing at Neomed, that an hour is a bit lighter lift, though incredibly impactful versus some other lengths. I did have, that you can do, there's the opportunity to do in person, right? And then there's, especially for train the trainer, and then there's also the opportunity to do via the webinar or electronically, however you want to say it.
Yeah.
What did y'all typically do, and how did you choose that particular mode of learning?
So historically, I believe we did some collaboration with even surrounding counties, so not just Wayne and Holmes, and we were doing the in-person train the trainer, which a lot of people like better, and we like better, but we don't always have the numbers. So we have done some of the online trainings as well. I think whatever is most convenient for you. I think a lot of people like the in-person training. It seems a little more engaging. We believe that's a little more successful, but we have had to certainly utilize the online training.
Nice, thank you.
Thank you to everyone for joining us today, and thank you, Jessica, for your presentation.
Yes, Jessica, thank you so much. Appreciate hearing your experiences, and thank you all for joining. Y'all take care. Thank you.